The United States Centers for Disease Control and Prevention is the national public health agency of the United States. It is a United States federal agency under the Department of Health and Human Services and is headquartered in Atlanta, Georgia. Its main goal is to protect public health and safety through the control and prevention of disease, injury, and disability in the U.S. and internationally. The CDC focuses national attention on developing and applying disease control and prevention. It especially focuses its attention on infectious disease, foodborne pathogens, environmental health, occupational safety and health promotion, injury prevention and educational activities designed to improve the health of United States citizens. The CDC also conducts research and provides information on non-infectious diseases, such as obesity and diabetes, and is a founding member of the International Association of National Public Health Institutes. The Communicable Disease Center was founded July 1, 1946, as the successor to the World War II Malaria Control in War Areas program of the Office of National Defense Malaria Control Activities. Preceding its founding, organizations with global influence in malaria control were the Malaria Commission of the League of Nations and the Rockefeller Foundation. The Rockefeller Foundation greatly supported malaria control, sought to have the governments take over some of its efforts, and collaborated with the agency. The new agency was a branch of the U.S. Public Health Service, and Atlanta was chosen as the location because malaria was endemic in the southern United States. The agency changed names before adopting the name Communicable Disease Center in 1946. Offices were located on the 6th floor of the Volunteer Building on Peachtree Street. With a budget at the time of about $1 million, 59% of its personnel were engaged in mosquito abatement and habitat control with the objective of control and eradication of malaria in the United States. Among its 369 employees, the main jobs at CDC were originally entomology and engineering. In CDC's initial years, more than 6.5 million homes were sprayed, mostly with DDT. In 1946, there were only 7 medical officers on duty and an early organization chart was drawn, somewhat fancifully, in the shape of a mosquito. Under Joseph Walter Mountain, the CDC continued to advocate for public health issues and pushed to extend its responsibilities to many other communicable diseases. In 1947, the CDC made a token payment of $10 to Emory University for 15 acres of land on Clifton Road in DeKalb County, still the home of CDC headquarters as of 2019. CDC employees collected the money to make the purchase. The benefactor behind the gift was Robert W. Woodruff, chairman of the board of the Coca-Cola Company. Woodruff had a long-time interest in malaria control, which had been a problem in areas where he went hunting. The same year, the PHS transferred its San Francisco-based plague laboratory into the CDC as the Epidemiology Division, and a new Veterinary Diseases Division was established. An Epidemic Intelligence Service was established in 1951. Originally due to biological warfare concerns arising from the Korean War, it evolved into a 2-year postgraduate training program in epidemiology, and a prototype for field epidemiology training programs, now found in numerous countries, reflecting CDC's influence in promoting this model internationally. The mission of the CDC expanded beyond its original focus on malaria to include sexually transmitted diseases when the Venereal Disease Division of the U.S. Public Health Service was transferred to the CDC in 1957. Shortly thereafter, tuberculosis control was transferred to the CDC from PHS. And then in 1963 the immunization program was established. It became the National Communicable Disease Center effective July 1, 1967, and the Center for Disease Control on June 24, 1970. At the end of the Public Health Service reorganizations of 1966 to 1973, it was promoted to being a principal operating agency of PHS. It was renamed the Centers for Disease Control effective October 14, 1980. In 1987, the National Center for Health Statistics became part of CDC. An act of the United States Congress appended the words, "and prevention," to the name effective October 27, 1992. However, Congress directed that the initialism CDC be retained because of its name recognition. Since the 1990s, the CDC focus has broadened to include chronic diseases, disabilities, injury control, workplace hazards, environmental health threats, and terrorism preparedness. CDC combats emerging diseases and other health risks, including birth defects, West Nile virus, obesity, avian, swine, and pandemic flu, E. coli, and bioterrorism, to name a few. The organization would also prove to be an important factor in preventing the abuse of penicillin. In May 1994, the CDC admitted having sent samples of communicable diseases,